Let's now speak to Philippine General Hospital spokesperson Dr. Jonas del Rosario. Dr. del Rosario, thank you for joining us this morning.
Hi, good morning, Ria, and your televiewers.
Doctor, hospitals are reporting an influx of COVID patients, and some are doubling or even tripling. How many patients, COVID patients, do you have in PGH right now?
We have, as of today, 102 patients admitted in PGH. That was a significant increase because as of 2 weeks ago, we only have about 60 patients in the hospital.
When did you begin to observe the increase in COVID patients?
We started noticing it last week. For about 7 days, it was steadily increasing by tens, and then about 3 days ago, we breached the 100 mark again. We have been in the mostly 70s to 80s for the past 4 months. So the highest so far that we reached was 105, which is the biggest number, just like what I said, in the last 3 months. The other thing that we noted was our ICUs are also slightly increasing already to about 80% of its capacity.
That being the case, Dr. del Rosario, are there still enough beds for COVID patients at your hospital?
We do. Actually, we have, as a COVID referral center, PGH, at least 200 beds for COVID. The thing that we did was we actually closed one ward for COVID and converted it to a non-COVID ward because we also have a lot of patients who have non-COVID concerns. But now we have to probably have to go back and reopen it and be ready for the surge in the COVID admissions. I was told by our admitting team in the emergency room that there are at least about 25 on the waiting list to be admitted to our hospital.
About 25. Okay. Doctor, can you still admit patients in Metro Manila? I mean, if cases in Metro Manila reach 3,000 cases per day, as is being predicted by Octa?
Well, we have to. We will have to open up, just like what I said, our COVID facilities again, and now we have to get our manpower from the non-COVID wards back to their COVID post. But our limit is about 200. Probably we can stretch it a little bit more, but really the increasing number is a red flag.
Sir, do any of your healthcare workers from PGH, have they contracted COVID from this new surge?
Yes, actually, that's another thing that happened in PGH recently. Normally, we will have some healthcare workers who will test positive for COVID because we're very strict about testing them just in case they have symptoms or they got exposed. Then we do test them. When March came in, the first 4 days of March, we had about 15 healthcare workers who tested positive. So that was again something that was unusual, and so we did a lot of contact tracing, testing, and we ended up putting about 88 healthcare workers on quarantine. So more or less, we had about already like 25 healthcare workers who got infected with COVID. So because of this, we put stricter guidelines. People probably are becoming lax. At the same time, we also did some measures to limit the number of people going in and out of PGH. For one thing, what we did was we closed we didn't close, but we did not allow any more walk-ins in our outpatient departments. Everybody has to get an appointment via online, and only when the doctor through telemedicine tells them to come to PGH, that's the only time they can go there to have a face-to-face encounter with the physicians. We also ask our medical students, our 4th year and 5th year medical students, to go back to their homes, and we suspended their clinical rotations in PGH. We don't want to unduly expose them. There's a threat of the new variant in the communities. And we actually sent our specimens to the Philippine Genome Center to see if we already have the variants from our patients or even from our healthcare workers. We were told a couple of days ago that out of the 30 specimens that we sent, we have the presence of a South African variant in one of our specimens.
All right, so that's 1 out of the 30 that tested positive for the South Africa variant. Now, Doctor, you mentioned you have about 80 of your staff on quarantine because of the 25 or so healthcare workers who tested positive for COVID-19. Does this in any way affect your hospital's ability to operate efficiently?
Yes, it did. There was a significant number of the anesthesia department who were part of these people who got quarantined. And because of that, we had to slow down our operations, especially the elective ones. We do the emergency procedures, but the elective procedures have to be postponed.
All right. And your hospital was one of the first to receive, or the first to receive, the vaccinations last week. How many of your staff have been vaccinated against COVID-19?
As of last Friday, we had a 5-day vaccination of Sinovac. We had about 1,773 vaccinees. The vaccination will resume today. This time we are going to inoculate AstraZeneca.
All right. Thank you so much for your time this morning. We always appreciate it. PGH Spokesperson Dr. Jonas del Rosario telling us there that they currently have 102 patients admitted at PGH for COVID-19. They're going to reopen one of the COVID wards, which they previously closed, and they have space for at least 200 COVID beds so far. 25 healthcare workers there tested positive in the first week of the month, and 80 healthcare workers from PGH are currently under quarantine.